Welcome to Diagnosing Health Care, a podcast featuring thought-provoking conversations about the latest legal, policy, and regulatory issues in healthcare. While these issues may seem like hurdles, we'll also look at the business opportunities and solutions that exist. Diagnosing Healthcare is brought to you by the healthcare lawyers at Epstein Becker Green, a leading law firm that has more than 40 years' experience serving clients in the healthcare industry nationwide.
Today on Diagnosing Healthcare, we discuss the privacy and security concerns companies must weigh as they consider implementing electronic verification tools to facilitate reopening, such as apps to track vaccine data and digital vaccine passports. The vaccine passport, an electronic record of vaccination, has been a major topic of discussion as businesses and governments consider how to balance privacy and safety as the rollout of the COVID-19 vaccine continues. Hello and welcome. I'm your host, Jessika Tuazon. I'm an attorney in Epstein Becker Green's healthcare and life sciences practice based out of our Los Angeles office. While the Biden administration has committed to making vaccines available to all adult Americans by the summer, it has stated that there will be no federal mandate requiring Americans to get vaccinated. In recent days, the administration has said that state governments and the private sector will take the lead on developing vaccine passport initiatives, which is likely to lead to a patchwork of approaches across the country related to requiring proof of vaccine credentials. On today's show, we're going to talk about the concerns related to the use of vaccine passports, such as the collection and use of individuals' personal health information. We will also discuss how companies can implement better privacy and security practices to mitigate or manage concerns associated with vaccine passports. If you like what you hear today, please subscribe to the show. Diagnosing Healthcare is available wherever you get your podcasts. Joining our discussion today is Patricia or Trish Wagner. She is General Counsel and Chief Privacy Officer here at Epstein Becker Green. She guides clients through the labyrinth of HIPAA and other privacy laws and regulations that protect patient and consumer information. Thanks for joining, Trish, and welcome.
Thank you, Jessica. Glad to be here.
Great. And also joining our show today is Alaap Shah. He's a member of the firm in the healthcare and life sciences practice in the firm's Washington, D.C. office. His practice focuses on legal issues related to health information technology, cybersecurity, big data analytics, and digital health strategies. Welcome, Alaap.
Thanks, Jessica. Happy to be here, and what a timely topic.
Wonderful. It's great to have you both here on Diagnosing Healthcare today. So let's get started on our discussion. As of May 2021, about a third of Americans have been fully vaccinated, and over 1 million new doses are administered on a daily basis. With the number of COVID-19 cases falling across the country, businesses are eager to return to pre-pandemic operations. Companies have increasingly become interested in using vaccine passports, as many see them as an important key for returning to in-office operations quickly, while still offering an additional degree of assurance that steps are being taken to limit the transmission of the virus. Trish, can you walk us through, at a high level, some examples of the various vaccine passport options that are being developed and or used by industry today?
Sure, Jessica. And I'm going to back up just a little bit to make sure we're all talking about the same thing when we talk about vaccine passports. So as you know, when you get the COVID-19 vaccine, you get a vaccination record card, and that was created by the CDC. And the passport concept is really just an extension of that, where individuals or whether individuals would have to show that card as proof of vaccination in order to gain entry into a business or into their workplace or into a venue. The federal government, as you noted, has indicated it will not have a federalized vaccine passport program. And as a result, we are seeing the private sector and states approaching the issue differently. Certainly, there are states like New York that has rolled out a state-sponsored vaccine passport program, while there are other states that are taking action to prohibit businesses from requiring proof of vaccination, or in other words, prohibiting the use of vaccine passports. On top of that, we also have private actors who are developing apps and other methods for people to use as vaccine passports as they travel from state to state or into other jurisdictions. So if we focus for a minute on places that may require a vaccine passport for entry, I'm sure anyone who's received a vaccination record card has thought about how to keep it safe and how to make sure they don't lose it. The natural progression from that, of course, is to create a digital version of that card, something that could be available on your phone or available on a website that you could print out when you needed it, so that you can easily provide proof of vaccination to the extent you'd need it to gain entry, or, for example, for travel. As I noted earlier, the state of New York created a state-sponsored passport program that allows individuals to print or to have on their phone access to their vaccination record. And so when they go to a venue, the venue can just scan their phone and know that the individual has received the COVID-19 vaccine. That passport program also has reporting for whether or not someone has tested negative for COVID-19 and actually whether someone has tested and has antibodies to COVID-19. So it's actually a fairly broad use of the passport system. We've also seen providers create vaccine passports, perhaps thinking about the number of individuals who they've vaccinated who will come back to them in 6 months or a year requesting proof of their vaccination. And the providers who have done this have essentially created a medical record that the individual can carry with them, a vaccine card that is digital that allows the individual to access their vaccination record whenever they would need it.
Thanks, Trish. That background is extremely helpful. I wanted to touch on one of the examples you mentioned, where a health provider's app that documents a patient's vaccination record is used by patients. Though a vaccine card could qualify as protected health information, HIPAA protections do not follow the vaccine card. For example, HIPAA does not protect medical information that a patient shares to others, like an employer or a private business. Could you elaborate a little bit more on whether HIPAA applies and the limitations on its application to vaccine passports?
Yeah, that's a great question, Jessica. And the concept of a provider creating a vaccine passport creates the real distinction here. So if a provider would create an app that would allow someone to carry the record of the vaccine with them, to the extent the provider is creating that app or is holding the information, that provider is governed by HIPAA, and all of the protections of HIPAA would apply to the provider's use and disclosure of that information. However, once an individual makes the decision to share that data is no longer protected by HIPAA. So, for example, if someone shares their vaccination record as they enter into a business, the business is not a covered entity under HIPAA and wouldn't be obligated to protect the information in the same way. Similarly, to the extent third parties are creating apps to create vaccine passports, if those third parties are not covered entities under HIPAA, are not providing the services as a healthcare provider, health plan, or someone acting on their behalf, those entities too would not be covered by HIPAA. And so the information that they gather would not be protected under HIPAA, although there may be other state laws that would protect the information.
Terrific. Thanks, Trish. I think this clarification around HIPAA will be very useful for our listeners. A growing number of Americans are eager to use vaccine passports to return to work, crowded events, and generally normalcy. Many remain distrustful of the app's ability to secure personal information. Those who are skeptical of vaccine passports have questions about consumers' ability to control their own data, including the extent to which individuals may share personal and medical information. Based on what we've heard so far today, it sounds like consumer protection and not HIPAA appears to be the primary privacy and security concern associated with these vaccine passports. Alaap, what do you see as the biggest consumer protection issues?
Yeah, that's a great question. And I'll start by saying that the road we're on, it's really all about trust. What I mean by that is, much of the success or even lack thereof during this pandemic response effort, starting from the belief about the reality of the COVID-19 spread and the impact it was having, all the way through this vaccination program we're in now, and moving forward into the vaccine passport phase as a means to return to normal, it's really predicated on trust. We saw a number of instances where a lack of trust has arguably led to things like uncontained spread of the virus, resistance to getting vaccination, and therefore I think it would likely be a key ingredient to the success of the vaccine passport program as well. In terms of consumer protection, anytime that we have a paradigm where people are seeking a way to gain access to sensitive information on vast swaths of people and storing that all together in centralized databases and then looking for ways to share that information pretty largely, that creates risk. It creates risk to personal privacy of individuals. It creates data security risk. And so to establish trust and maintain trust, you really need to be thoughtful in your approach to doing this kind of program where you're collecting huge amounts of data that's sensitive in nature. I think in the absence of a clear regulatory framework, we really have to look to consumer privacy protection as the means to make sure we have a framework that makes sense for people to adopt this kind of passport program.
Thanks, Alaap. I think that makes a lot of sense. So without a federal plan, the US will likely follow a patchwork approach to vaccine passports where different states and individual private businesses determine whether, and if so how, to request verification of vaccination and/or negative COVID-19 test results. In addition to navigating different state laws for vaccine passports themselves, to what extent should companies be thinking about state consumer protection laws?
Yeah, that's a great question too. And I think, even taking a step back from what states might do from a regulatory perspective, we have to be reminded that in the absence of clear regulation, there are other privacy principles and practices that people should follow just to ethically collect and use information, typically referred to as the fair information practices and principles. And those include a number of different things which undergird pretty much any privacy and security regulatory framework. So first and foremost, I think these programs should be thinking about how to be transparent about their collection, use, and disclosure of personal information. And that means providing adequate notice and getting consent from users of the vaccine passports. And essentially, you just want to make sure that the individuals using these apps or whatever you want to call them are engaged and aware about what they're signing on to. You also want to limit the collection of the information to what is absolutely necessary to achieve your aim. As you can imagine, the more data you collect on a person, the more risk there is. Reduce what you collect to what you really need. And then also make sure you're specific about what you're going to do with that data and limit your use and disclosure of that data to those things that you said you would do. For example, don't promise to use data to verify vaccine status if you also plan on tracking passport users in terms of like where they're traveling or what kinds of interests they may have and what kind of events they go to. That may be sort of beyond the scope of what someone had agreed to. So it's pretty simple, those couple of principles. It's really about say what you do, then do what you say. Then there's a couple other principles I think that are also germane, which is make sure that the data is of sufficient integrity and quality. Again, this is about trust. So we want to make sure that if someone's using these passports, either as an individual or perhaps a business that's trying to verify vaccination status, that people can trust that the data coming out of that is valid. And of course, secure this data. When you're centralizing huge amounts of data in one place, if you have problems with maintaining the security of that, you could have people tamper with that. And as you can imagine, in this context we're living in today, where some people are vaccinated, some people are not, some people might get a vaccine passport and some won't. So that'll create perhaps discrimination risk in terms of who can get access to certain things and who cannot. It really creates incentives for people to perhaps engage in fraud and misuse these tools. So really critical. And then ultimately, you want to make sure that these companies that are building these tools are held accountable to these principles. Long and short of it is, even before we get to regulation around this and what state laws, for example, may apply, these core principles are things that companies building vaccine passports should be considering as they develop these tools and use them in practice. In terms of the patchwork and navigating various state laws, you're right, it is a patchwork. And it's not just a US one, it's going to be a global one for that matter. There are going to be many competing options likely for consumers in terms of what passports they use. Whoever creates a passport program should really be focused on giving consumers more control, being very transparent with those consumers about their data collection, use, and disclosure vis-a-vis these information principles we just talked about. Some of the touchstones for doing this right are coming out of the more aggressive states. And I say aggressive to show, some of those more sort of consumer focused states like California. Under the California Consumer Privacy Act, which is a leader in the consumer privacy space on a state basis, it's likely that an organization that creates a vaccine passport that obtains more than 50,000 or so California residents' personal data will have pretty strict requirements about providing notice to individuals, providing those individuals right to access of that information and portability of that information, as well as the right to erase their information from that system and perhaps opt out as well. there are also private rights of action and other penalties in play for violation of these rules. So if you're building a vaccine passport that you envision being used in California specifically, but even nationally, these are the types of laws you're going to want to be attuned to so you can understand what the requirements would be to build not only a solution, but how your organization will have to operate with the data that you're managing on behalf of individuals. And I'd say that there's also the Federal Trade Commission in the background. So let's not forget about them. They obviously take consumer protection very seriously, and they have rights to protect consumers from unfair and deceptive practices as well as it relates to privacy and security. You'll likely see them step into the fold and have some enforcement around this if people do this the wrong way.
That background is extremely helpful. And I think that the principles that you described will be helpful for all of our listeners to continue to think about as we see this issue continue to evolve and develop. I'd like to try to tie all of this together. If we were to assume that a client is located in a state that has not prohibited vaccine passports or other similar certification programs, when deciding whether to roll out a vaccine passport company-wide, companies will need to carefully balance wanting to resume their normal business operations with consumer privacy concerns that we've been talking about today, all while still managing the public health concerns that are related to COVID-19 and its transmission. What should a client think about or look for in a passport program? Trish, maybe let's hear from you first.
So, just dovetailing on what Alaap just said, I think the first thing whenever a company is collecting personal information on any individual, the first question ought to be, why do I need the information and what information do I need? And will the information I'm collecting actually provide the utility that I think it will? And then once you've thought of that, then you figure out what's the least amount of information I can gather to achieve my goal. And then the next step, of course, is, okay, now that I have the information or now that I'm going to get the information, how long will I need to keep it? Is it sufficient for me just to, for example, for a venue, know that I scanned people's vaccination passports as they were coming in, and I don't need to store that information because I can verify that anyone who didn't have a vaccine passport wasn't allowed entry? Or will there be legal or regulatory reasons that I'd want to keep proof that I scanned all of the entrants into the venue for a period of time? Then, of course, if you need to store it, you need to protect it. And all of that is layered with making sure that individuals know exactly what you're gathering from them and exactly what you're going to do with it, and then only doing what you said you're going to do.
Thanks, Trish. I think that raises a really important question. Do you have suggestions for better privacy and security practices that companies can implement to mitigate or manage these concerns associated with vaccine passports that Trish has just mentioned?
Yeah, I mean, Trish made so many good points. Just to add a little bit of color on top of that, there have already been a few models discussed in these early efforts to create vaccine passports, ranging from systems where essentially a person has a portable medical record and you would display the medical record as it is, whether it's through a smartphone or otherwise, to whomever's requesting it. The more sort of locked down version of that is QR-based code, which is scannable by whomever's requesting the record, and no actual information is shared with that recipient of the information. It's just a scan that happens, and then ultimately a yes, no about whether you meet the criteria of vaccinated or COVID-free. You can imagine there's a pretty wide spectrum from one side to the other. And to Tricia's points and some of these fair information principles we discussed, I think those that gravitate towards the sort of more quote unquote lockdown version where less information is being shared will likely have more success because, again, you don't really need to share the underlying information or display it because that creates disclosure risk. It creates other risk that information may be collected in ways or used by others in ways that it shouldn't be. And I guess the other thing I would say overall is that companies should approach this problem as truly temporary in nature. While it made sense to trade some of our personal privacy for this public health response in the context of the pandemic, that trade-off shouldn't be construed as a green light to sort of continue to collect and use and disclose personal information beyond the scope of the pandemic response. So companies really should commit to sort of restoring that privacy equation to a pre-pandemic way as soon as it's feasible. And again, to echo Trisha's comments, that means collect only what you really need for the passport program and only use it to achieve the aim of protecting your workforce or protecting your patrons, and limit the retention of that data to the extent you can. Don't use it for secondary purposes beyond what you consented individuals for. And of course, get rid of the data as soon as you don't need it anymore. To the extent you are maintaining data, maintain the security of that data. Put in robust security controls for any systems that are housing that data until that data is deleted. I mean, that's going to be really critical because we're going to have lots and lots of different vaccine passport creators, systems, and that's rife for abuse by people that are nefarious in nature. Those are my 2 cents.
Thank you so much, Trish and Alaap. This conversation has been extremely helpful in helping to better understand some of the privacy and security concerns that are related to these vaccine passports. To close out our discussion today, as we've discussed, there are still a number of unknowns when it comes to the future of vaccine passports here in the US and across the world. I'm very interested to hear your predictions. What do you think the adoption of vaccine passports will look like in, 6 or 12 months down the line?
When I predict something, it's almost always a way to make sure it won't happen. So let me try. I think that certainly, I think it will be driven maybe more internationally and seep into the US. I think travel is going to be a big driver of the use of vaccine passports. I think as people travel internationally, they are going to need to be able to demonstrate proof of vaccination. And I think people are going to get more and more comfortable with that as time goes on. Now, to Alaap's point earlier, maybe the question is, after hopefully in 6 months, we're on the downside of the pandemic and we're all feeling pretty good. And then maybe we start to think about whether or not we really want to share that information with individuals. But I do think we will go through a period of time where it becomes almost second nature.
Alaap, how about you? What's your prediction?
Looking into my crystal ball, I'd say that like the vaccination effort itself, I'm thinking that this adoption of vaccine passports is likely to be uneven, partly because it's, not going to be available to all. It's going to be only adopted by some and used by some. But, it will be helpful for those that adopt the passport to restore, the freedoms that we missed during the pandemic, like going to a baseball game or a concert or traveling internationally. As Trish pointed out, we all want to be in some exotic destination. But, I'd also say that it's a matter of time. Practically speaking, I think we're all trying to get to herd immunity, and vaccine passports is going to be one step closer to herd immunity, I hope. And vaccine passports should be moot at that point. But I will say the train's left the station. Clearly, there are lots of efforts underway to build collaborations around vaccine passports domestically and internationally. Many big tech companies and large healthcare organizations are coming together to build this kind of infrastructure. And obviously, the states and some private organizations and even the federal government, to some extent, are really spending a lot of time and energy and money on helping to create these things in the appropriate way. I'm pretty sure that they will come to fruition. How widely they're adopted is going to be an open question. And I think that question really is, again, predicated on what we started with, which is it's about trust. If you build these things in the right way, you manage the privacy and security risks, and you engender and maintain trust among the public, then people are more likely to adopt these tools. Individuals want that. That's clear. Companies are already thinking about privacy and security at the outset as a core principle of these programs. And businesses that will likely leverage these vaccine passports to get people back to work or into their businesses really need to be taking this stuff seriously too, because, in order to get that economic boost of having re-engagement with patrons, you have to be thinking about maintaining the privacy of those patrons who are coming in and working with your business. I think it will be adopted. I'm hoping that they go away eventually. But I think, to Tricia's point, they will become part and parcel of everyday life for a period of time.
There's also a potential that the vaccine passport really becomes a first step to individuals realizing how much they can control their medical records. Certainly, OCR and the Office of the National Coordinator right now are promoting the fact that individuals should be in control of their medical records. And in some ways, the vaccine passport maybe is the very first step of that, because I can create a digital record of my vaccination status, and I can share that however I decide to do so. I can either choose to share it or not. And it's possible that that actually becomes the gateway to individuals realizing there may be other uses for them and other benefits for them having more control over when and how they can share their medical records.
Thank you so much, Trish and Alaap, for joining me today. I think you both raised such interesting points about this issue and have given our listeners a lot to think about. And I certainly look forward to monitoring this issue and seeing whether your predictions come true in 6 to 12 months. So thank you once again for joining us. It was such an absolute pleasure having you on our podcast.
Thank you, Jessika.
Yeah, thank you very much, Jessika.
To our guests, thank you for listening. If you like what you heard, please subscribe to the show. Diagnosing Healthcare is available wherever you get your podcasts.
Thank you for listening to Diagnosing Healthcare. For show notes on today's episode, additional episodes, and more insights on trending issues in healthcare, please visit diagnosinghealthcare.com and be sure to subscribe on your preferred platform. The Employment Law This Week and Diagnosing Healthcare podcasts are presented by Epstein Becker Green, PC. All rights are reserved. This audio recording includes information about legal issues and legal developments. Such materials are for informational purposes only and may not reflect the most current legal developments. These informational materials are not intended and should not be taken as legal advice on any particular set of facts or circumstances, and these materials are not a substitute for the advice of competent counsel. The content reflects the personal views and opinions of the participants. No attorney-client relationship has been created by this audio recording. This audio recording may be considered attorney advertising in some jurisdictions under the applicable law and ethical rules. The determination of the need for legal services and the choice of a lawyer are extremely important decisions and should not be based solely upon advertisements or self-proclaimed expertise. No representation is made that the quality of the legal services to be performed is greater than the quality of legal services performed by other lawyers.